And last but not least, we have Paul Moulton from Isle of Man Television. Good afternoon, Paul. Fast am I.
Good afternoon. My questions are for Mr. Ashford, I think. You're talking there about 111 being still under some pressure. Can you take us through this? I believe there's 2 rooms, there's 2 banks of lots of people, but how many people at any one time are answering those phones?
Well, at the moment, Paul, that's within Cabinet Office, so I don't have those numbers. It's not run by DHSC, but my understanding is they have radically increased the staffing. They've been bringing volunteers in to help as well and to train up. So my understanding, certainly from the conversations I've had with Cabinet Office, is that those numbers have increased quite dramatically. The simple fact is, with the sheer amount and volume, it is always going to be a challenge for us trying to keep the vaccination programme going as well, which has to be a national, a national priority. As I say, everything has just come together. That will now start to tail off because we will be seeing less and less, hopefully, unknown cases and therefore less spread in that way, and the spread will be purely down to people who we already know about in isolation. So that then reduces the pressures on 111. Like I say, this isn't unusual. Other countries have seen it as well. The UK has seen pressures on their systems, and I certainly know Jersey, when they were at the height of their recent outbreak, they were saying it would take up to 3 days for people to be able to get test results back, and if they had queries, it would take that long to be answered.
So you say it's increased dramatically. Can you give us what it was and what it is now as far as you're aware?
Well, like I say, I don't have those figures because DHSC isn't in charge of 111.
I know, but you said it increased dramatically, so you have some idea. Someone's told you a number.
What I mean by increased dramatically is the workload they're dealing with. So we've increased the number of letters they're dealing with vaccination. So, for instance, the cohort that's just going out is 7,000 letters. We know the number of tests being undertaken daily has gone dramatically up. So, for instance, I think yesterday was 500 tests undertaken. We've had other days of that where previously they would have been dealing with maybe 100. So you're talking numbers trebling, quadrupling or more of the workload to be undertaken. So they have put extra staff in, but we are never, with the best will in the world, going to be able to gear up that they can do things instantly. There is other avenues as well. People do have email addresses that they can potentially send queries to. They also, of course, now can register for the vaccine online using the online form. So there's things like that that will reduce pressure and give people other avenues rather than having to hang on the phone to 111. It is a difficult time. It's a frustrating time for many people out there. But what we say is people do have to bear with us at this time and understand the pressures that exist.
And just to finish this, you said there were some technical issues some time ago. Were they resolved? So it's working better? People aren't dropping off?
My understanding is there were some technical issues with the line. So again, it was that perfect storm scenario. It all coincided. We've been working with Manx Telecom, and my understanding is that those technical issues have now been resolved.
Dr. Hewitt, is there anything you'd like to add before Paul moves on to his next question?
No, thank you.
Okay, thanks. Paul, your next question.
I've been hearing situation up at Nobles Hospital. Two cases I want to highlight. One, this young lady was in a ward and she had nowhere to get a shower. She had no access to do that, and the family and friends were very concerned. And secondly, a gentleman was left to use a commode for going to the toilet, and there was no other option, so he actually discharged himself, and he was a COVID case. Are these the exceptions? Are these just what's coming out? Is everything okay up at Nobles Hospital? You're managing?
Yeah, as far as I'm aware, everything's okay, Paul. I can't comment on things I don't know about or haven't been told about. I'd be interested to know how a COVID case, though, managed to discharge themselves because they're effectively isolated up at the hospital. So I'm not quite sure how that works. But I can't comment, obviously, on individual patient issues publicly anyway. That would be highly inappropriate for me to do. But I'm not aware of either of those two issues, so I couldn't comment in general anyway.
But the question, are they coping, meaning is everything, as far as you're aware, okay up there?
Yeah, the hospital is under pressures. We have staffing pressures, of course, because we've got staff in isolation, exactly the same as anyone else. The staff are doing an absolutely brilliant job, exactly the same as they did 12 months ago. And again, I'll take it as an opportunity to thank all of the staff across health and social care and all of our key workers who've been doing an absolutely wonderful job keeping things running. We've had to adapt the hospital. That has meant turning certain things off. That's meant creating a COVID ward in order to be able to cope. But the measures that we had in place last year, we can go back to and have been moving back to, and as far as I am aware, they are working. But like I say, individual cases I can't comment on publicly anyway, but those 2 cases I specifically can't because I've not heard of them before.
Thank you. I'll see you Sunday for more questions. Thank you.